What is SIDS? Sudden infant death syndrome, or SIDS, refers to the unexpected and unexplained death of an apparently healthy baby, usually during sleep, typically between 1 and 6 months of age, with the peak between 2 to 4 months. It's also called crib death, because it often occurs during sleep without any sign of struggle, illness, or warning. The long-standing mystery. For decades, SIDS was a diagnosis of exclusion. If no cause could be found after a full autopsy and investigation, it was labeled SIDS. Parents were often left with no answers, and the mystery created waves of fear and guilt. Theories over the years included breathing obstruction, parental smoking, brainstem dysfunction, immune system failure, and vaccinations, which are now debunked. But none fully explained why some infants died and others didn't. Major scientific breakthrough, 2022. Key discovery, low levels of BChE enzyme. In May 2022, a landmark study published in eBiomedicine by Dr. Carmel Harrington from Sydney Children's Hospital made a major breakthrough. Findings. Blood samples from newborns who later died from SIDS showed significantly lower levels of the enzyme butyryl cholinesterase, or BCE. BChE is involved in the brain's arousal system, particularly in the autonomic nervous system, which controls involuntary functions like breathing, heart rate, and waking up from sleep. Why this matters? Babies with low BChE may have an impaired ability to wake up or respond to stressors like low oxygen, a key failure in the so-called arousal pathway. This enzyme could be a biomarker, meaning a simple blood test at birth might identify at-risk babies in the future. Contributing risk factors. Even with this biological insight, SIDS is multifactorial, meaning several things can combine to increase risk. Known risk factors: sleeping on the stomach, overheating during sleep, soft bedding or pillows, parental smoking during or after pregnancy, premature birth or low birth weight, and lack of prenatal care. Prevention Back to Sleep campaign. Since the 1990s, public health campaigns like Back to Sleep, now called Safe to Sleep, have dramatically reduced SIDS deaths. Recommendations: always place baby on their back to sleep. Use a firm, flat mattress with no loose blankets or toys. Keep the sleep area smoke-free. Share a room, but not a bed with the baby. Use a pacifier during naps and nighttime, which is linked to reduced risk.